Good afternoon. My name is Dr. Rosslyn Biggs. I am a beef cattle extension specialist here with Oklahoma State University Cooperative Extension, as well as Director of Continuing Education for the College of Veterinary Medicine here at OSU. It's my pleasure this afternoon to welcome you to the Ranchers Lunchtime series. And specifically today, we'll be visiting about the Vac45 program opportunities and considerations. So today we'll talk about the herd health programs as part of the Vac45, as part of most Vac45 certifications. Now with that, we will point out a couple of things. We did have some technical difficulties during the live delivery with the recording, and so we are recording this after the fact. So if you attended with us live, we want to thank you for that, but also you may notice some things will be a little bit different, particularly our polling features as well as our question and answers at the end. So we start out the discussion today really thinking about Vac45 programs and why and where we would want to participate in those as producers. And so I want you to think about, are you currently participating in a Vac45 program? Specifically, have you participated in the Oklahoma Quality Beef Network's Vac45 program that's here and offered through Oklahoma State University? And if you are looking at a program that maybe you haven't visited with in the past, we want you to, hopefully we'll answer some questions for you today. So last week we visited, or Dr. Raper visited with us and had this slide in, and I wanted to include it again too, of what does a typical Vac45 program include? Obviously we've got a vaccination protocol. Those calves, if they're bull calves, need to be castrated and they also need to be healed. If we are looking at horns, we want either polled genetics, or if they had to be dehorned, we want them healed there as well. We also want, for most programs, a parasite control program. They've got to be weaned at least 45 days and broke to the feed bunk. So today, I want to talk about really 4 key areas, either your veterinary relationship, we'll also talk about vaccination protocols and some considerations there, parasite control as well, and then talk to you about therapeutic standard operating procedures that you should be considering. So I want you to think about, do you currently have a valid veterinary-client-patient relationship? And so for those of us that are veterinarians, the Oklahoma Practice Act really defines that pretty darn clearly in the language there in the Practice Act. And so I've plucked that right out, copied and pasted it, and want you to take a look at what I kind of consider some of the key features that folks need to be thinking about when it comes to the veterinary client-patient relationship, or the VCPR as you may have heard it referred to in the past. So we're looking for that veterinarian to assume responsibility for making medical judgments regarding the health of that animal, but we're also looking for the client, owner, or caretaker has agreed to follow those instructions. The veterinarian must have sufficient knowledge of the animal or be very familiar with the operation with timely visits or have recently seen that animal. The veterinarian also has to be available for follow-up, and we also obviously have to always follow those federal laws and regulations as well. So when it comes to various medical protocols, I think it's a good idea to sit down with your veterinarian and think about what your operational goals are. What's your current herd health status? What's the specific disease risk for your area? You may be very familiar with that, but you may not be. Your veterinarian will certainly be understanding of the things that they are facing on a day in and day out basis as they help producers in your area. We also want to think about the economics of the protocol and make sure it makes financial sense. We also want to think about what the goals are. Are we selling in a market, or are we trying to sell privately? Are we a seed stock or purebred producer? And then again, get back to what's that sales plan, what's that marketing plan, and where are we looking for these cattle to go long term? So when it comes to implementing those plans, it's important to remember a few logistical things when it comes specifically to Vac45. We want to think about, where are we going to process these calves? Are we going to process them on the ranch, or are we going to haul them into the veterinary clinic for processing there? What's the timing of processing going to look like? When are we going to administer those vaccinations, for instance, with respect to age of those calves? We want to also think about medication purchases and making sure we have medication available to us in a timely fashion and readily available, but also make sure that we're purchasing from reliable sources. And so your veterinarian can help you with that. And then getting back to that standard operating procedure or specific disease protocols, looking to see what's your long-term goal there and how are we going to carry out those protocols should an animal become ill. So a few questions we recommend you think about is, are you currently vaccinating your cow herd? Because that can determine what type of vaccine you may want to use for those calves. And if you are administering vaccinations, what specific vaccinations are you giving to that cow herd? And we don't want to forget the bulls as well. So you want to speak to your veterinarian about specifics there and which products are most appropriate for your specific situation and the area that you're operating in. If you're administering respiratory vaccines, we want you to think about, are you using killed, are you using modified live, and do you understand the reason of which vaccines we're giving? So when it comes to vaccine protocols, there's not really one size fits all. And so I think that's critical for us to remember. There is no cookbook recipe for a vaccine program. There are some common things that we see, though, minimum recommendations for most Vac45 programs. And this is specifically for the calves. So on those calves, we generally want to see respiratory viruses administered, infectious bovine rhinotracheitis, parainfluenza 3, bovine viral diarrhea virus, both 1 and 2, as well as bovine respiratory syncytial viruses. And those generally come in a combination vaccination. We also want to think about clostridial vaccinations. Commonly, we would call that, are we given a blackleg vaccination, and which one are you using there, 7-way, 8-way, or even a 9-way? And, if you're making a choice there on which one to use, you definitely want to think about how you're castrating your bull calves, and specifically if you're banding, you want to make sure you've got tetanus in those clostridial vaccinations, and that we're getting those vaccinations administered to those calves at a minimum 2 weeks prior to banding. Most Vac45 programs also require a Pastorella vaccination, specifically for either Mannheimia hemolytica or Pastorella multocida, which are 2 common bacterial agents that we see in bovine respiratory disease or pneumonia. So with these vaccination protocols, we want to make sure that we read the label. Don't want to throw that box away, throw that insert sheet away and not take a look at it. There is a possibility that that vaccine may have changed since the last time you used it, and you want to make sure that we're following all label directions. We want to make sure we keep good records, specifically with identification of which calves were administered vaccines, what time, what brand, and exactly what went into those animals for our records. And obviously, we want to always follow beef quality assurance guidelines. And if you're not familiar with beef quality assurance, we encourage you to visit their website for more information and training. So back to those vaccines, we want to make sure if we're taking the time and effort to participate in Vac45 programs that we're giving effective protection with those vaccinations. Again, back to that, do we choose killed? Do we choose modified live? There are certain situations where you may choose one or the other, and so I encourage you to visit with your veterinarian about which of those choices makes the most sense for your particular operation. Additionally, we want to make sure that we take a look at those vaccines and that we're using a vaccine that's well in date, that we've not surpassed those expiration dates. And so generally speaking, we want to encourage you to purchase those vaccines as close to possible prior to processing so that we have good dated vaccine. We want to make sure on temperature maintenance, again, you can take a look at this infographic at the bottom, keeping right here within this green range from 35 to 45 degrees, really at all times. And that includes both when we're refrigerating that, as well as transporting the vaccine, and then the time of administration too. And for UV light, there's a number of things that can affect our vaccinations, and definitely UV light is one of them. And so we want to keep that in mind too, as well as if we're using reconstituted vaccine, which or in most cases there's modified live vaccine, that we're administering that modified live vaccine really within an hour. So we want to keep in mind, if we're buying modified live vaccines, you may want to think about purchasing smaller bottles. Think about what your processing time generally is. Can you get all your calves through the chute? Can you get them all of them vaccinated within an hour? So again, this is a summary of handling vaccines, and it's a good reference for us to keep in mind as we look at those vaccinations. Again, we want to purchase as close to processing time as possible. We want to purchase from reputable sources. Got to read those vaccine labels. Use a refrigerator thermometer in whatever refrigerator that you're using, especially if it's a refrigerator on its second life in the garage or in the feed room or in the barn. Make sure and it's doing the job that it's supposed to be. Again, you want to use those reconstituted vaccines within an hour, and you always want to be cautious if you're using reusable syringes that we're not inactivating vaccine by prior cleaning on that, that we're not exposing those vaccines to any kind of detergents or soaps. So the vaccination timing for calves is really critical, and on the Vac45 programs, we're really looking for 2 rounds of vaccination. And our common times to administer those vaccinations are the most common for the first round is typically either at branding or at weaning. Occasionally, we will see some operations that are using pre-weaning vaccinations. Again, that's 2 to 5 weeks prior to weaning. But generally speaking, most folks in this part of the world are vaccinating either at branding, where calves are 2 to 3 months of age, or right then at weaning. When we look at that second round of vaccines, we can get 2 rounds prior to weaning, and that's something that we may need to look at as we go along, as we look at additional research and knowledge about the success of our vaccines and administering those at the least stressful periods of an animal's life. But usually we see most of those second rounds of vaccinations either at weaning or post-weaning. So here we ask participants, when are you given that first set of vaccinations to your calves, and when are you given the second set of vaccination to your calves? And if you're anything like my family, that was generally when everybody was gathered up. It seemed always to be either a holiday or a weekend when you had plenty of help to get the job done. And so keep that in mind as we're looking at these Vac45 programs, making sure you're meeting those marks, because that's really critical that we're administering these vaccinations in acceptable timeframes for these programs. So when we took a look at the Oklahoma Quality Beef Network data from 2014 to 2018, again, as I mentioned before, the most common combinations were either at branding for the first round, followed by a second set of vaccinations at weaning, or alternatively, given that first round of vaccinations at weaning, followed by post-weaning. So when it comes to parasite control, we've got 2 really major categories of parasites, either internal parasites or external parasites. When it comes to internal parasites, injectable dewormers, oral dewormers, and then pour-ons are our most common options. And I'll tell you from my personal preference, I have a tendency to lean towards injectable, as I can make sure I get it into that calf. I know that it gets there and I can dial it down. I may save myself money by being able to administer that medication directly to the size of the animal. Alternatively, we got a lot of discussion these days about resistance when it comes to internal parasites, and so we want to keep in mind we may use a combination of injectable and oral dewormers together. So talk to your veterinarian about what makes sense for your operation and what makes sense for your area. When it comes to external parasites, really kind of have five different types, and we're talking external parasites in most cases, flies for sure this time of year. They're already setting in on us. We're looking at a pour-on fly control or either fly tags as well. Other options can include insect growth regulators, sprays, and cattle rubs too, or you may find a combination of all of those or one or two of those that works best for your particular situation. So when we move to disease treatment standard operating procedures, it is critical that you have a discussion with your veterinarian. And in my mind, it really needs to be an annual review of those protocols as to, for instance, if we're going to see respiratory disease, what are we going to do next? How are we going to monitor those animals? Are we going to administer antibiotics? Is that necessary? Are we going to treat an animal with fever? And then what medications? If the answers to those are yes, which most commonly they are, which medications are we going to choose? We want to have these discussions before we're in the heat of battle, so to speak. We want to have those discussions in advance, develop the plan. Definitely think we need to think about putting those in writing, because you always need that documentation when it comes to it. And if you've got multiple people that are handling the animals, monitoring the animals, working on the operation, we want to make sure that training is available and also document that training if necessary. Common illnesses that you may want to have a talk about would be obviously respiratory illness. That would be the most common one in calves of this kind of Vac45 age range, but also may want to talk a little bit about bloat, lameness, and others as well. So want to speak to a handful more specifics on respiratory disease and what are our options as far as going about these approaches. And so I think it's critical to say, how are we going to assess illness and what are the indicators that warrant either additional diagnostics or additional treatments. And so having those discussions with your veterinarian, again, as I said before, well in advance is critical. And then also, if we've treated these calves once, are we going to come back at them with a retreatment? And if so, what medications are we going to use at that time? There's continued discussion, and it's really critically important of the need to really look at these SOPs of how we're treating disease, in particular with respect to antibiotics and potential development of antibiotic resistance. We only have so many antibiotics in the world these days, and haven't had a new one really online in a number of years. And so we want to make sure that we are being good stewards and taking a look at, are we potentially creating antibiotic resistance? And then, to complete most of these disease protocols, the standard operating procedures, always want to think about necropsy as an option, because taking a look at why that specific calf, we lost that calf, and taking samples, submitting those samples to a lab like our Oklahoma Animal Disease Diagnostic Laboratory for additional testing is really a good idea and can give us a wealth of information in trying to treat the ones back home and make sure we don't end up with a real train wreck on a group of calves. So when we look at what is the cost, and Dr. Raper did a great job last week, and I encourage you, if you didn't have a chance to take a look at that offering, go back to the video and take a look at that recording and really key in on a number of the items that she shared with us. But you may be looking at this cost going, some of you all may be going, well, I may be pretty lucky at what I'm paying, and others may go, whoa, I'm really overpaying. And so I think it's, again, back to what we talked about in the vaccination protocol. There's really no one size fits all, and there's a number of variables that go into what is your total cost per animal to get these calves qualified for a Vac45 program. Generally speaking, most of our respiratory vaccines are going to run $2 to $3 an animal. Now, obviously, we want to keep in mind if we are vaccinating a lot of animals at one time, we may be more cost efficient there than if we're only vaccinating 2 or 3 at a time. Our clostridial vaccines generally run $1 to $2, if that, and deworming, external parasites, fly tags, again, about $1 a piece there in most cases. Implants, $2 to $3, castrations around $5, and dehornings in most instances, $5 to $10. Now, again, there can be a high degree of variability when it comes to these costs, so I encourage you to visit with your veterinarian and see what are the best options for you as far as, are you going to administer these treatments, or are you going to have the veterinary practice you work with handle it there? You know, those are obviously back to that processing location. Do we have shoot fees or trip charges? And, you know, I think facilities are a good discussion too. If you call me out and we've got 10 calves, but it takes us 4 hours to work, I know that's a little bit of an exaggeration, but if it takes us several hours to work a handful of calves, we're probably charging you by the hour in addition to the cost of the medication. And it may be, in the long run, way more cost effective for you to haul those calves into the clinic where they can get them through much quicker. So as we've mentioned, group size and calf weight sure plays into what of our expenses are. And then gets back to it, what those personnel costs, if we're able to administer those ourselves, or are we going to have to hire folks to come assist? So this particular slide was one that Dr. Raper gave us last week, and I think it's really critical. You can see there's distinct advantage to taking a look and participating in Vac45 programs in my mind, and then specifically as we look to these various practices and what was adopted and what was the potential return. I think it's really critical too to consider that these returns are by the hundredweight, not just by the head. So if you're looking for additional resources to take a look at, ask some additional questions, definitely want to direct you to the OSU Beef Cattle Manual. That particular document, that manual is under review and should shortly be updated for new information and new research based on those topics. But it really brings together a wealth of information, as does your veterinarian. And you've heard me say it time and time again today. What are, you know, visit with your veterinarian, visit with your veterinarian. I can't emphasize that enough. Mentioned before, Beef Quality Assurance has resources for you in a variety of areas, and those are available online at bqa.org. So again, if you're considering a Vac45 program and you've not participated before, or maybe you have, I would encourage you to take a strong look at the Oklahoma Quality Beef Network. And these again are the requirements. They got to be home-raised calves. We've got a vaccination protocol set up for you with 3 different options you can choose from as far as timing, and a combination of either modified live or killed that may fit your particular situation. As most of these, they got to be castrated and healed, dehorned and healed. Got to be weaned at least 45 days. That's, of course, the 45 part of the Vac45. And you will also receive program compliant tags. And there is verification by a third party, which are our OSU Extension educators that do a great job out there verifying this information for you. We also want to make sure that we recognize our historic sponsor of this program. The Oklahoma Cattlemen's Association has been really key in making sure that the OQBN got off the ground and has continued its success. So this is my information. You're welcome to shoot me an email. I'm located at the veterinary school here on campus. I'm happy to visit with you, and feel free to give me a call or shoot me an email. And again, we encourage you to join us each week through June 18th on Thursday from 12:30 to 1. Occasionally we go a little bit longer than that, so you might plan for that. But next week, Dr. Beck will be visiting with us about nutritional programs and implants that are really critical on the success of these calves, really making the biggest impact they can within these programs. So thank you for joining us today. If you do have questions, you're certainly welcome to let us know, and we hope you can join us in the weeks to come. And you're also obviously welcome to view the various recordings that are shared on OSU's beef cattle website. Thanks again.